I am with Reverend Dr. Stavros Kofinas, moderator of the Commission of Churches on Health and Healing. Hello, Father Kofinas. Hello. I will ask you a couple of questions, and as a starter, if you could please share a bit about the journey that led the World Council of Churches to create or recreate the Commission of Churches on Health and Healing.
From what I understand, the World Council of Churches has been dealing with the area of healing and caring for the sick throughout its history. Of course, as I have mentioned, that is a major pastoral area of the church, is caring for the sick. Christ was the one who said, heal the sick and preach the good news. But with the coming of the pandemic and after the pandemic, we saw all the issues of health kind of all of a sudden springing up, and it seemed like the World Council of Churches felt that there was a special need for the Commission to deal with the issues that have arisen, not only from the pandemic, but from those that were even before the pandemic that came to the surface.
Okay, thank you very much. Hence the concept of holistic health and healing, I guess.
Yes, I just have to be a little bit careful with the word of holistic, because holistic is used very liberally, and I'm a little concerned about its theological implications in terms of different spiritualities. Personally, I would say that dealing with the whole person, body, soul, mind, emotions, with the whole person, or with all of the person, to get away from any type of theological dilemmas.
Okay, thank you. Thank you very much, Father Kofinas. Could you maybe share also about the structure of the Commission and probably its methodology, its goals, how it would make some topics more preeminent through this structure?
We have 25 members on the Commission. They're very talented. Most of them are in the field of medicine, many doctors. And we've had already 2 sessions altogether. And what we did is we formed 4 work groups. The main problem in health is the accessibility to health care. That is the first group. The second is dealing with the major health issue that now is in our society, and that's mental health. And we have the area of HIV and reproduction health, which is an area that the World Council of Churches has been dealing with for many years. And we felt that that has to continue and broaden. And in our day and time, that area is also very important because it is in many ways associated with the whole aspect of what sexuality is, what eros is, what makes up relationships, loving relationships, and that whole area there that now needs special attention. And then what came out from the pandemic was the area of faith and science, where in many ways there was a clash, and at the other way there was a need to work together. On that, I found that during that area that what came out is that healthcare workers need to know more about how churches stand, but we as a church also need to support the healthcare workers and the medical professionals. And in that dialogue, we will be able to form a type of spiritual bond.
Thank you very much. That's very inspiring indeed. And I would like also to ask you, from the work of the Commission, how would WCC member churches directly benefit from the work done by the Commission?
Well, if we're dealing with the whole person, well, then we have to deal with the whole ecumeny, with the whole world. So the multiple aspects that we hear from many people and their experiences in health and what's going on in the world will enrich each one's ability to care, and to be able from one church to learn what is going on in the other church so that it will enrich its ministry. I think, though, that what we have to find is a way where what we're doing in the Commission and the World Council of Churches can reach each pastor who is in the parish dealing with the sick, and how it can reach all the doctors and healthcare professionals and let them know that this is going on. And that's a big challenge.
And in this context, would you be able to explain a bit how you would be working closely with international organizations such as WHO or international NGOs?
Well, most healthcare professionals are associated with many organizations. So if we can reach the organizations and we can convince them in our own way to implement what we're saying and recognize it, then they will be able to pass it on, and we will become like partners in their efforts. See, many times those organizations see us as opposed to them. We have to see that we're working with them. We have to show them that we're working with them.
Father Kofinas, would there be anything also that you would like to add, something to share personally?
My concern is that the Commission not just deal on a surface and medical level, but it is enriched with some theological meaning and is able to express itself in some theological way. Because I think that we have to be able to provide an existential aspect to what health and healing means. And that's, I think, something that many times we forget. And that's what people are searching for.
And finally, I wanted to ask you the question about young people and how they could be involved in your work.
That's an interesting question, and I'll give you a personal experience I had. We have in the network of the Patriarchate, Ecumenical Patriarchate for Pastoral Healthcare, we formed fellowships for medical professionals and health workers. And I had a retreat for one of those fellowships in America, in Nashville, Tennessee, and a young lady who stood up, and she was a medical student, a student of medicine. And she told me that if you don't have young people in your network will die. So what we have to do is find a way where we can get the young people who are studying medicine, particularly, and those who are studying nursing particularly, to become more aware of what we're doing. And that's also a big challenge. I think that what the churches need to do are form retreats and special gatherings for those young people, where they have a sense of solidarity, where they're not alone, where they know that the church is supporting them, and where we're able to learn one from one another. It's a challenge that for the WCC also to bring medical students together from all over the world, to be able to do that, to know that there is something there beyond their small world. You know, I've been a hospital chaplain. I was a hospital chaplain for many years. You can become institutionalized in your hospital and think that that's the only world that you live in. It's important to know that there's a world beyond that world, because it gives you a lot of enrichment and support.
Thank you very much, Father Kofinas. Thank you for sharing this.